Shingles is on the rise in Singapore, with some family doctors seeing a 10% spike in cases over the past 2 years. They say this is likely due to an aging population and immune systems weakened after the COVID-19 pandemic. While a vaccine for shingles remains a costly option, there are other ways you can strengthen your resistance, as Sabrina Ng finds out. Some viewers may find some of these images in this report disturbing.
These red, often stinging bumps are called shingles. Experts estimate that up to 30,000 people in Singapore get it each year. While rarely life-threatening, they can cause intense pain for weeks, and in the worst cases, years. Doctors tell CNA that shingles tend to attack those under high stress and the elderly.
The risk of shingles is related to age, and certainly with a weakened immune system with age, the number of shingles cases, the absolute numbers, would be expected to rise with our aging population. About maybe half might get shingles by the time if we live up to 85 years or beyond.
And recently, a new factor was added to the mix: COVID-19. Global studies suggest it may weaken the immune system, in turn resulting in a higher chance of triggering shingles.
The risk for shingles may remain elevated for up to 6 months after COVID infection. But I think the jury is still out as to the exact mechanism and connection between COVID infection and shingles reactivation.
Even so, Dr. Po, who oversees a chain of 38 clinics, has observed about 10% more patients with shingles since the pandemic. They're often treated with painkillers or antiviral drugs. While a shingles vaccine is on the market, it can cost nearly $1,000 out of pocket. It's also unsubsidized in Singapore due to cost-effectiveness concerns, and the Health Ministry remains in discussion with the jab's manufacturer on pricing.
So we can't expect the government to subsidize everything. So if you are above 50, I think for your personal needs, you may want to consider doing a vaccination, especially if you are 50, you have diabetes, you are 50, you have any immunocompromised condition. What is cost effective for yourself maybe is not the same as what is cost effective for the country.
Meanwhile, doctors say a more viable prevention way is to be vaccinated for chickenpox, which is free for all Singaporean children. That's because shingles can only develop in someone who's had chickenpox before. They also advise a healthy lifestyle, with regular exercise and good nutrition, to strengthen the immune system and prevent shingles.
What exactly is shingles? It may resemble chickenpox, causing itch and pain, but the two illnesses differ in how they develop and who they commonly affect. Shingles and chickenpox are caused by the same varicella zoster virus. While chickenpox infections happen most often in childhood, the virus stays in the body and can be reactivated later in life, and that's developing into shingles. So if you have had chickenpox before, you may be at risk of shingles down the road, especially if you're past the age of 50. As for how the illness is spread, chickenpox is highly contagious. You can contract it via contact with blisters, saliva or mucus of infected individuals, or from being exposed to their coughing or sneezing. After exposure, symptoms then develop within 10 to 21 days. On the other hand, shingles cannot be passed from person to person. You can only get it if you have had chickenpox before. And if you do develop either chickenpox or shingles, you may experience similar symptoms like fever and a headache. With chickenpox, bumps appear about 2 days after other symptoms, turning into fluid-filled blisters that eventually scab and fall off. A shingles rash has red patches and painful blisters and usually affect just the one side of your body.